Okay, and I'm going to say thank you ever so much to Vicky and Jack for joining us today. This is such an important issue and something we get asked about a lot on Reminds. And I'm going to hand over to both of you, if that's okay for you to introduce yourselves and sort of take it from there.
Off to you, Vicky.
Thank you. So, yeah, welcome to our talk. So we have been asked to do a talk on PTSD and trauma. So we are both from CAMHS in Southampton. My name's Dr. Vicky Russ. I'm a clinical psychologist, and I'll let Jack introduce himself.
Yeah, and my name's Jack Wilson, and I'm an assistant psychologist also in Solent CAMHS.
Lovely. So hopefully today is just a bit of an introduction around PTSD. Obviously, I hope you appreciate it's a huge topic. We could spend ages and ages and ages talking about it, and it's something we're really passionate about, but we've only got an hour, so hopefully it will be a quick introduction with some direction to some resources and some other ideas, and we'll also give the opportunity to ask any questions at the end as well. Okay.
Great. Yeah, so I think one of the things that we were thinking about when when we were asked to do this presentation is how do we make this the most helpful possible, because I think obviously, as Vicky mentioned, it's such a huge topic. So I think we focus very much on how to how to understand trauma, and then B, how do you as parents manage any kind of symptoms of trauma, or if your child experiences traumatic events. And part of that is kind of what we've done is we've adapted quite a lot of stuff from this book, Helping Your Child with Loss and Trauma by David Trickey, who is one of the kind of foremost psychologists in kind of working with trauma, with decades of experience, and is one of the co-founders of something called the UK Trauma Council. There's a link to that resource towards the end of the presentation, but he wrote this incredible book, which is very much about helping parents whose children have experienced trauma. And I think that whilst this presentation is kind of loosely based on his work, it's a wonderful kind of entry into kind of thinking about how do you help your child, and is extremely actionable as well. So yeah, next slide please, Vicky. Great. And I think it's important first, because obviously something that runs alongside traumatic events is also stressful events, because we all experience stressful events, and in that sense they're really similar to kind of germs, bacteria, disease. Whatever happens, we do get sick at one point, and you can't avoid that. And whilst it's really helpful to minimize exposure to the really bad ones, they can't be avoided indefinitely, and they probably shouldn't be either, because I think we can't avoid stress. So it's helpful to think about how do we boost a child's immune system ahead of getting sick, rather than avoiding the sickness altogether, so that they're able to kind of manage different levels of stress over time. And whilst we can again minimize that exposure, some stressful events are unavoidable. You know, buses might not turn up, there might be delays on holidays, there might be no food that they want, there might be really difficult moments in school. And I think it's thinking about not trying to avoid those, but trying to manage those as much as anything else. And I think it's trying to separate out some stressful events from traumatic events, which we'll kind of come on to now. So I think it's good to define trauma, because I think obviously it's such a big word and it captures so much, that when we're using trauma, we're referring to adverse events that are intense enough or severe enough to potentially cause enduring distress and or difficulties. And the kind of types of traumatic events could be, and I stress aren't limited to, personal events like abuse, assaults, accidents, bullying, bereavements, or natural events like disasters, or large-scale events like terrorist attacks, pandemics, was. But there's so much within all of that. It could be like there could be really specific incidents that don't sit within that, and that's not to say it's not a traumatic event. It's just that often traumatic events fall within that kind of remit. And during or in the aftermath of very, very stressful or traumatic events, children naturally, like adults, would experience that kind of distress, that anxiety, the fear, and other difficulties, which are unavoidable and totally understandable and to be expected in many ways. And those reactions can be extreme, but they can also not be a cause for concern, because part of that can be part of the natural processing of traumatic events. For children, these reactions often tend to calm over time and return to their baseline after a period of them being kind of a bit of an outlier. And kind of moving on to what that can look like, there tend to be 4 paths, and hopefully that you can all see this as optimistically as we do, which is that research is really consistent in showing that there are 4 paths of recovery, and I often unaffected. Over half of children appear to be relatively unaffected and don't report difficulties, which is fantastic. And that's not to say that initially they don't show those kind of distress or extreme reactions, but I think over time they're extremely they're unaffected in the long term. Recovered, so a third of children show high initial distress for days or weeks, but in the following months there is much less, which again is really, really good. Then sometimes children can display a kind of delayed response. So they seem to be unaffected in the short term, but over the longer term, they then display difficulties sometime later. That again could be weeks, it could be months. And then last thing, and that might be some of the stuff that we're thinking about more today, is around 10 to 20% of children experience distress initially and over time. But is a percentage that's a really, really kind of fantastic, that's a very encouraging percentage, and kind of speaks to children's overall resilience. So even more encouragingly is that research shows that a quarter of children with PTSD symptoms 1 month after the event did not have PTSD 3 months afterwards. And then after that, those children, a further quarter, didn't have PTSD symptoms 6 months after the event, which is really, really good, and kind of speaks to that whilst trauma can be so overwhelming and so distressing and so difficult, that a large percentage of children, whilst that kind of initial period is really difficult, over a longer period of time begin to show a kind of really remarkable recovery. So what's typical? And because I guess that's kind of where PTSD comes into the question, is when is this more than my child struggling? When is this beginning to kind of be an issue? And I think first off, as everyone probably knows, recovery isn't really a smooth process, and that's okay. Even in the recovered pathway, it can go up and down a little bit, and that is normal. And there can often be points where it feels like it's a bit more difficult, like afterwards than at the beginning, and that's also fine, because children can encounter things that trigger those kind of specific memories or those experiences that mean that they might be reliving some of that, and that's okay. And some of the stuff that we're going to talk about in the second half of the presentation is very much around what we can do around that. And recovery isn't a straight line. Often when I talk about it, it's kind of like I tend to talk about it as kind of like a squiggly line that kind of rolls back on itself, moving up in an upward curve, because sometimes it does feel like you're taking a step back, but that doesn't mean that in terms of recovery you are taking a step back. Some reactions can be really easily noticed. It could be getting into fights, it could be nightmares, it could be really struggling to separate, or it could be avoiding specific things. But also some reactions can be really hard to notice because for many different reasons, but it could be that they're experiencing a lot of anxiety internally, or they could be hiding their reactions, and that could be to do with not wanting the people around them to react to their reactions in many ways. So part of thinking about what's typical is also thinking about what our responses are to children's kind of typical responses as well. And we've got, this is a resource, a video from the UK Trauma Council, and what's amazing about this is that young people with PTSD or who have experienced PTSD have created a lot of resources which can be super helpful and really informative. So it's just 3 minutes and hopefully kind of explains actually what PTSD is much better than we ever could.
And I'm really hoping that this works and that you can hear the sound, but I might not have pressed the right button, so just let me know. No?
Yes, very quiet sound. It's very quiet, but we do have sound.
I think what you can do, Vicky, if I remember rightly, is you can, like when you're sharing a screen, you can share your computer sound.
Yeah.
And then
I might also just need to take my headphones out then. Maybe that would help. Do you think that would help?
Yeah.
Maybe not.
Yeah, why not?
Let me try it again. Oh yeah, share sound. And current slide. Please rewind it a bit.
Yeah, that's working.
These memories just keep going around and around in my head. I feel crazy.
At school, there's so many people and so much noise. Sometimes I just want to burst.
When I sleep, the nightmares always come. So I force myself to stay awake.
Did you know that at least 1 in 3 children experience trauma before their 18th birthday? Traumas are situations where you feel very scared or unsafe. It might also be where you feel very frightened for the safety of the life of someone else. Sometimes these are one-off events, or sometimes they happen lots of times. It might be hard to even remember one time from another. When a person has experienced trauma, it can make them feel unsafe or unsure about the world. It can be normal to feel this way right after you've been through trauma, as you make sense of what happened. But if these feelings last for months and make life harder, it could be PTSD. PTSD stands for post-traumatic stress disorder. Sometimes people think PTSD is just for people who've been through war, but it's not. It can be experienced by anyone who's been through trauma. In fact, in some cases, up to 1 in 3 children who experience trauma might go on to develop PTSD. So what is PTSD? PTSD can look different in different people. Many people with PTSD experience flashbacks or nightmares. These are memories that might come out of nowhere, or they might come when you see, hear, or smell something that reminds you of what happened. They can make you feel like you're in danger all over again. You might feel jumpy or on edge, like you're always ready for danger. You might have lots of trouble with sleep or concentrating. It's also very common to want to avoid any thoughts or feelings about what has happened. You might try very hard to push thoughts or memories away, or avoid things that might remind you of what happened. PTSD can make life really hard. It can make you feel like you can't trust anyone, or like everywhere is unsafe. But help is available. If you think you might be struggling with PTSD, you could talk to a trusted adult, to a doctor or GP, or call a free confidential helpline. They can help you to find places you can go to for support. We have treatments that work well to help young people with PTSD. You don't have to just live with it. The best treatments we have is called trauma-focused cognitive behavior therapy. If you or someone you know might be struggling with PTSD, there is hope. You are not alone.
Okay. So hopefully that video was helpful in just giving a bit of an insight into what a young person might experience if they have PTSD. So that video mentioned nightmares, it mentioned feeling on edge, mentioned kind of having feelings of like reliving the event, anxiety. So all of that, so those are kind of the really common symptoms of PTSD. And what I thought might be helpful is oh, I knew that would happen. Is to just talk through using an example of someone that I've worked with, and they've given me consent to share this information, although I'm not going to use their real name. But a young person, a 17-year-old girl who I've worked with in CAMHS who had PTSD. And I thought I would just talk through actually what her PTSD looked like for her, but using something called the cognitive model, which is what we tend to use in order to understand someone's PTSD experiences. And the cognitive model basically means we're really looking at how that PTSD or how that traumatic event has changed someone's beliefs, their cognitions. Cognitions is another word for beliefs. So it really focuses on actually how that traumatic event has changed the young person's lens through which they see the world, and actually how that then drives a lot of anxiety and a lot of the fear that we can see. So as I said, this is a real young person's experience. She's given me consent, but I'll use a different name, so I will call her Jasmine. So the traumatic event that she had experienced was a fire in her garden, a very significant fire, which spread. Several fire engines needed to be called and significant damage was done. And the family had to evacuate. And this was in the evening, and Jasmine it was the one who had to call the fire engine, and she had to evacuate her family. So for her, she was then left with certain triggers. So triggers that would increase her PTSD symptoms. So her triggers were being around bonfires, the smell of smoke, seeing lights flickering, looking at her shed in the garden, or also looking at the tree in the garden, which was still quite badly damaged. So those for her would trigger off these trauma-colored beliefs. So these beliefs which have been affected as a result of the trauma. So she was left with beliefs of I'm to blame, we're going to lose everything, and we are in danger. So whenever she was in the presence of these triggers, these beliefs would really come to the forefront, which understandably would then trigger further thoughts of it's happening again, as in a serious fire, it's all my fault, I could have stopped it. And what we understood was that that was then driving a lot of fear, anxiety, guilt, and shame for Jasmine. And the way that she would feel those feelings in her body is she would be sweating, her heart rate would raise, she would actually smell smoke again. So in that video kind of talked about reliving and having intrusive experiences. That for her was an intrusive sensory experience. There wasn't smoke around, but she could smell it. And she felt very on edge in the face of some of these triggers. And this was happening every day. And in order to cope with all these difficult thoughts and feelings and bodily reactions, she would avoid thinking about it, avoid talking about what happened, avoid places where there might be fire, avoid certain places in the garden. But if there was a fire, so if they did a controlled fire in the garden, like to burn paper or anything like that, in one of those little metal tubs, she would sit and watch it for hours and hours and hours until she knew it had definitely gone out, which would obviously impact her sleep. And this, as you can see, kind of creates this vicious cycle. And what we understand in PTSD is actually the avoidance that comes with PTSD it loops into this cycle. So actually, because we don't end up facing our fears and we don't end up challenging some of these thoughts that we have and gaining our confidence again with some of the things that we are finding anxiety provoking, actually this cycle just continues. So whenever these triggers are around, we continue to think it's happening again, it's all my fault, I could have stopped it. Hence we get stuck in a PTSD loop. The lovely thing is that I worked with this young person, Jasmine, and she is doing amazingly now. So one of the really wonderful things about the evidence base and the research that we have now is that PTSD is very treatable. So as Jack said, for those small proportion of young people who do experience PTSD after a traumatic event, actually the recovery rate is very good. So I did trauma focused CBT with this young person, which was the treatment mentioned in the video, and she gave me some of this feedback which she said I could share. So she said, I know now that I did all I could to stop the fire spreading. And that was really important for her, to let go of that guilt and that shame of feeling that she was to blame. She was able, so this was last summer, she was able to go and have barbecues with her mates over the summer and actually really enjoyed it and didn't feel anxious about it. She didn't get the intrusive smells or the intrusive thoughts anymore. She didn't feel on edge all the time. And what she said was, it's not going to go away or correct itself overnight. You have to put that work and time in, but I'm now better able to cope with it, and actually getting the help was worth it. So I thought I would just share that with you. The next thing that we thought about was actually to have a think about, okay, so if you do have a child, or you know a child who actually you think maybe they are suffering from PTSD, what might be helpful for them? What do they need from people around them? And what we've done is we've got a QR code here. So if you have a smartphone, if you go onto the camera and you hold your camera, hover it as if you're taking a photo of the QR code, a link should appear. If you click on that link, it will take you to a board where you can input some ideas. And what we'd really like you to do is just give us a couple of ideas, one idea about what do you think could be helpful for a child with PTSD? What do you think that they might need from people around them? And I'm just going to stop sharing this screen, and then I will bring the board up. Once you've had a moment, let me know if anyone's having trouble with it. Okay. So I'm just gonna share this so that we can all see it. Okay, so some lovely ideas. Thank you so much for sharing. So we've got understanding and parents who are willing to learn about it. Someone that understands what they've been through, what they're feeling. Schools to have knowledge of how to help them. Lovely. People around the child to have a better understanding of PTSD itself. Lovely. And not being afraid to tell people. And some practical strategies. Access to the right therapy, help. Yeah, lovely. Thank you so much for sharing those ideas. Those are all absolutely knowing it is PTSD. Okay, yeah. So it sounds like from that, what you're saying is actually for the people around the child to have an understanding of what they're experiencing, and for them to be showing that compassion and listen. So that might be parents, that might be schools, but also services. So like you say, actually access to the right therapy and help. And also some practical strategies. Actually, yeah, how do we help? What are some of the things that we can do? Lovely. Okay, thank you. So I'll just go back to the to the slide. Okay, great. So thank you for sharing that. So we're just good. So the second half of our presentation, which we are doing perfectly time-wise, so that's good. We should have plenty of time. Is we are going to talk about actually how do you support a child who might maybe struggling with PTSD. So I'm sure this won't, well, it might not come as a surprise. Hopefully it won't. But first things first, I know it's a cliche, but it's really important to put your own oxygen mask on first. And I'm sure people have heard of that metaphor before. And I know as a parent, it can feel like, yeah, all right, that's easier said than done. However, there is a reason that it's said. And as you can see from that first point there, often actually a trauma that a child has experienced is shared by their caregiver in some way, whether that's directly or indirectly, that carer is likely to be impacted in some way as well, which often means that carers are trying to care and process at the same time, which is really, really hard. And when your child experiences something so significant, of course, the tendency can be to focus on them exclusively. What parent or carer wouldn't? But what we do know is that that can come at a cost to your well-being. And it might feel selfish to do something for yourself, but if anything, it's absolutely the least selfish thing that you can do. And one of the reasons for that is that recovery from PTSD and from trauma is a marathon. It's not a sprint. And actually you need that endurance and you need that strength. You know, your child will need you to be there for them throughout that experience. And so it's incredibly important to care for yourself, do what you can in order for you to be the best support for your child. So we all know the metaphor, but think of it like oxygen masks on a plane. You need to put yours on before helping your child put theirs on. So one of the other things that parents and carers might find really helpful to do is to make sense of what your child might be experiencing, because actually it can feel really, really confusing. And so we just wanted to share with you a tool that we use called a formulation, which is basically an understanding or a map to help us narrate, tell the story of a child's difficulties. And the cognitive model that I explained before is a really great starting point for thinking about what might be going on. And the cognitive model mainly means focusing on what might that child's beliefs mean, what might they be thinking about when they're feeling this anxiety or this fear. So we've included this table, and if your child is struggling with PTSD, or you think they might be struggling with PTSD and you want to make sense of that, this is a really, really helpful way of doing this. So you can see you have 4 columns. The first is thinking about where and when. So what is happening when your child appears to be struggling, or when you think they maybe have been triggered, when you think they are experiencing high anxiety or fear or anger or distress. Where are they? When is this? What's happening? So in that before column, what was happening just before they became distressed? Who was around? What was the child doing? What were other people doing? Because that might help you then to pull out, actually, does anything seem to be triggering them? And often it's very, very subtle things. It might not be obvious to other people. So sometimes you really have to do that kind of detective work beforehand over a period of time before you start seeing those patterns. And then in that third column, during, what exactly do they do that show that distress? So describe that behavior. And afterwards, who did what afterwards? So how did people respond? How did that change what they were doing? And what we mean by that is, actually, was there any possible gain for that child? So what we know in PTSD is that it's kept going mainly by avoidance. So actually, was that child able to avoid something that actually they were feeling really worried about or really scared about? And actually, although that's such an understandable thing to do to avoid the thing that we're feeling anxious about, could that be what might be keeping things going? Could that be maintaining anxiety and PTSD in the long run? So that's just one potential tool for you to be aware of, to help you to start to make sense of some of your child's distress. Okay. And so there is something called the 5 principles approach to support recovery. And this has come together by drawing on the research and the clinical experience of what helps children with PTSD to recover. What can parents, carers, and those around them focus on in order to support that recovery? And they've come up with these 5 principles. So, safe. Children need to feel safe. Children need to be helped to feel calm. They need to be helped to feel socially supported and connected. They need help to feel back in control again. And they also need to support to feel hopeful. So after significant or traumatic events, your children don't need the extraordinary from you. They need extra bits of ordinary. So big events often come with these ripple events. These could be stresses like moving, changing schools, police investigations, things like that. And some of these changes can't be avoided, but they could be managed maybe with more care, more attention than maybe they might need at other times. So we're going to just talk through these 5 principles and hopefully give you some really practical takeaways of how you could support your child if you think they're experiencing PTSD.
So, sorry, being quiet for so long, just couldn't get the words out. So I think first up, as Vicky said, is feeling safe. And I think the first step in that is really covering off the basic needs, which is the food, the water, the shelter. So they feel like they know where and when these things are coming and kind of what's going on, because I think sometimes that can be really, really difficult at first, especially as Vicky mentioned, like there can be a lot of disruption in routine. So that's why that second step is also, how do we re-implement familiar routines to offer comfort and consistency? And I think that we all feel more comfortable in routines and kind of with a sense of predictability and kind of linking back to that extraordinary. Actually, we kind of want to get back into extraordinary to feel like, you know, the world is predictable, the world is understandable, because children are likely to be far more sensitive to even subtle changes, maybe in the way that people treat them, maybe in the way that things have just, you know, it just doesn't make sense in the same way, because their world may feel like it's fallen apart. So I think it's also really important to think about how we can also have honest conversations with them, because part of adjusting to like unpredictability is knowing why there is unpredictability. So and I think obviously honest conversations, or as honest as possible, has to be tailored for age. So what you may say to a 6-year-old is not going to be what you say to a 16-year-old in terms of why things have changed, but it's trying to speak to that child and give them as much information as they may need, why the changes are happening and why things may be looking the way they are. And then, and part of that is also that kind of step 3, which is meaning making, which is a really important process of feeling safer, which means the what has to come before the how or the why, you know, like what has happened, what's going to be happened. And it's covering off that, again, that predictability as opposed to anything else, because because they may be uncertain of everything of what's happened. And I think sometimes that specificity is really, really crucial for meaning making, because you can't understand the how or the why if you don't understand the what. The what is the kind of the foundation of everything that you kind of build on. So, and again, that meaning making, it needs to be comprehensive. It needs to be comprehensive enough, not necessarily comprehensive, and kind of continuing on with feeling safe is kind of thinking about how how your child may make sense of the event is influenced by how you think about the event, how you react to them, and how you discuss the event with them, which puts a lot of responsibility on parents. And I think sometimes, as Vicky was talking about, parents and carers are often trying to process and care at the same time, which means that it's kind of tricky, but being really conscious of how we're engaging to them. And I suppose it's trying to shift from that like reactive mode into very much a responsive mode, and maybe thinking ahead of time how to discuss events or the event with them, because it can be so tricky for them, I suppose, if for example, if they're kind of talking to you about something that's happened and and parents or carers may react negatively in some way. They may be distressed, they may be angry. It then kind of links back to what I mentioned earlier, which is that children may then begin to hide their reactions because they don't want their parents to be upset. They don't want their parents to be that. So I suppose it's how do parents hold space for some of those kind of really tricky feelings whilst present with the child. So that balancing is really, really crucial. So instead of attempting big conversations, it can often be more about trying to be curious about what they're saying, why they're saying it. That way you could be far more focused on validating and normalizing thoughts, because the like narrativization of events, kind of talking through what has happened, is very much part of a healing process. And that the more it's narrativized and the more the parent kind of attuned and able to validate what a child's saying, the more that you can kind of normalize those things that a child's talking about. And it's so therapeutic and powerful to help the child say the things that they think and they feel out loud, instead of kind of letting them rattle around inside their heads. And I think it's also letting the child say what they need to say, as opposed to trying to steer conversations towards towards a particular way of understanding. That kind of comes after them feeling safe and being able to kind of talk about it and having those emotional needs met.
Okay, so then the second principle is about feeling calm, and actually this is about both children and parents and carers. So the calmness can actually start with you. So the calmer that you are, the easier it is for your child to be calm and regulated. And thinking about when to have conversations. So actually when they're distressed, your child is probably going to really struggle to talk about what's going on for them. And so instead thinking about this notion of striking whilst the iron's cold, actually waiting until that distress has come down, and actually having that conversation when everyone's feeling calm enough. And a key part of this is being able to name emotions for your child, just being able to put labels to how they're feeling. So instead of saying maybe something vague like, I know how you feel, actually help them to really label and name that emotion. So saying things like I bet you felt really, really angry, so that they can start to recognize those feelings in themselves. There's a phrase which a very well-known psychologist says, which is name it to tame it. So if you can put a name to that emotion, and that might have to start with you doing that naming, it automatically, there's been brain scans that shows actually when you name an emotion, the emotion center in the brain automatically calms down without you having to do anything else. So that's really important, helping your child to just label, put names to what they're feeling. And I know someone mentioned about having some practical strategies. So thinking about how to help children feel calm and better regulate themselves is really important. And so we know that having some strategies in your back pocket is really key. You might have already found lots of strategies that help your child specifically, but some of the examples that we often use are breath work, so something called belly breathing, where you put your hand on where your belly button is, and when you're just gently breathing in and out, you want to focus on that breath coming from your belly, not from to calm the brain down when you breathe from your belly rather than your chest. Box breathing is where you find any box, so it could be the laptop screen, it could be a phone screen, could be the TV screen, and what you do is you breathe, you track your eyes along each of the 4 sides of the box, and you breathe in as you track up one side, you hold as you track across the other side, you breathe out as you track down the 3rd side, and you hold again for the 4th side. And you can just Google box breathing. It comes up with some really lovely, simple images to help guide you through that. But again, that's a really fantastic strategy to use. Breath counting as well. So actually just focusing on your breaths and just gently counting them can be a way to just bring your attention back onto the here and now. So things to do with your body as well. So this could be touching, could be affection, or it could be sensory in nature, like some big heavy movements like stomping on ice or leaves, pressure like a heavy blanket or a big bear hug, or it could be kind of some form of exercise, some way of kind of getting that energy out of the body. Or it could be head work, like actually visualizing a safe or a special place, which could be real or it could be completely imaginary, but actually spending some time just visualizing that in your mind and you talking through that with your child. Could be listening to music, could be reading stories together. And the other thing that's really important is about actually anticipating, so thinking ahead to potentially stressful or triggering situations and discussing how we might manage that together as a family. So what could they do, who might support them, where could they go?
Great. Sorry, I forgot I was muted. So feeling socially supported and connected, and I think that this is especially really crucial for parents and carers, because children can isolate themselves, and parents can also feel, and carers can also feel quite isolated after traumatic events, and generally, especially if a child's behaviour might be tricky. So I think it's assessing who is around you and your child to support them and you is really key. And I think part of that is helping the child feel maybe slightly more socially connected in a way of kind of setting aside intentional time to do things that they enjoy. I think it's potentially thinking about being persistent, even if they do continue to isolate themselves, never kind of like, I suppose, trying not to be disheartened if a child doesn't want to do something. Maybe it's trying to find something that might be one step up in the stairs, as opposed to like it could be that maybe they're scared to kind of go out to like a soft play area or to the park or something. So maybe the next step down from that, or a few steps down from that, is like doing what you would do in the park, in the garden, for example, or a smaller park, or going at a time when maybe they feel more comfortable. So setting aside that intentional time where you can be present. It could be raising the presence of family, friends, or members of yours and your child's community so that they can feel connected. And I think, you know, one of the wonderful parts of the age that we live in is that connection isn't just like hyper focused on physical connection anymore. I think digital connection can be amazing. So I think that type of proactive connection, social support, can be face to face. It can be text, video, letter. It could be voice notes. It could be FaceTimes. It could be lots and lots of different things to help that child know that people do care about them. They do love them. And I think also can help echo some of the messages you as parents or carers are trying to kind of communicate to the child. You can gently encourage and or facilitate them seeing friends up to their window of tolerance. And I think that that's it. It's important to stretch, but important not to push. And because depending on where your child might be, it might kind of dictate what their window of tolerance is. And kind of going back to what Vicky talking about, the formulation, if they are avoiding you, others, or places, I think it can be looking at why that might be and being curious about it, as opposed to frustrated by it. And that's not to say that you shouldn't be frustrated, because sometimes these things are really tricky. And I think as parents or carers, you can feel really kind of lost with what to do. But I think especially with your child, it's kind of addressing those things in cold situations where you might be able to park some of those frustrations or some of that kind of that difficulty that you're feeling, to be able to kind of be really present and help them feel connected with about why that is. And it could be, as Vicky was just discussing, narrating some of that as well for them, like, it must be really scary trying to go out after what's happened. Back to you, Vicky.
Thank you. Okay, so the next principle is about helping children to feel more in control. So part of traumatic experiences is often feeling completely out of control and a complete loss of control, especially if they've tried to prevent what happened and couldn't, or maybe they now view themselves as having no influence on a now unsafe world. And so a great place to start is looking at how to interrupt this cycle by offering little mini successes so that they can see how they can influence things around them. So really focusing on those little mini successes. Another way to approach this is to, even more than you might normally do, but to offer more realistic, keep offering realistic choices and real world opportunities to feel in control, which can help bolster their sense that they do have some choice and some control. And this can be really simple things like, do you want peas, beans, or carrots with your dinner? And actually for that to be something that they can have control over. So really looking at actually where are your opportunities to give your child a little bit more choice and a bit more control in what for them feels like a very out of control world at the moment. And sometimes it can be as explicit as empathizing with why they feel they can't do something. So I really get that you feel like you can't do that, but I believe in you and I believe that you are able to do it, and just offering that. And part of this might also be about managing their expectations and the expectations of adults around them. So actually it might be really important to focus on empowering and enabling your child in a really challenging situation.
I kind of I suppose lastly, before Vicky kind of pulls this all together, is feeling hopeful, because I think after traumatic events you can certainly fall into despair, you can fall into wondering if things will ever be the same, and that, I suppose, that puts a lot of responsibility on parents and carers to think about how do I project hopefulness. And part of that is about balancing an understanding of the past and how that impacts the present, but also whilst maintaining a focus on the present and the future too. And that could be thinking like, what does life look like in a year's time? Or depending on what the event is, it can also very delicately be thinking about what may they have learned from the event. And that and I think that can be a very delicate conversation and should be handled situationally and contextually. And I think it's also important for them to see, depending on their age, and I think a lot of this advice changes like the levels of implementation on their age. And I said earlier that 6 and 16 are very different in what you can do, but I think helping a child see that they might be unable to change the event, but the meaning can change over time, and what they understand of the event and what that kind of means to them isn't static, that it's actually, it can move as they move. And some of the difficulties can really come up that feeling like they're the only one in the world experiencing this. So discussing normal psychological reactions to trauma can be useful, as well as finding people that may have experienced and overcome similar experiences. And that could be within your wider network. That could be examples on TV. That could be, it could be in films. It could be finding different things. But I think most importantly, if we're trying to think about what qualities and characteristics can parents like embody, is that calm, open curiousness to support that sense of hope for a child. And I think it's and that's really important. I think thinking very crucially about how am I with my child.
Thank you. Okay, so considering all those 5 principles, actually you might want to select a team around your child to help them overcome their experiences. No one can do this all by themselves. And so it might be worth spending a bit of time thinking about who your supporters and teammates could be. Could be family members, could be neighbours, friends of family, members of your faith community, professionals, coaches, activity leaders, anyone that you might be able to think of to help your child or to be able to help them. And as Jack said, focus on people who you think can be consistent and reliable and predictable. Focus on people who you think can be calm and reassuring, warm and compassionate, who can be collaborative, so they can work with you, and also optimistic, who can help you to hold that hope as well. And it might even be worth pulling everyone together to meet and actually discuss who's going to do what, because as I said, no one person can do it all. So actually you might want to assign someone. Actually, you're going to be the person who focuses on mini successes with my child. I want you to be the one to keep noticing all those mini successes to them. And I want you to be the person who can talk through the story of what happened, because you have maybe more information, or you're the person who they feel safest with. So yeah, really thinking about actually for you as parents and carers, who is your network, who is your team, who can help you to do this. And so we're coming to the end now, but just thinking about, hopefully we've given you plenty of ideas about how you can support your child who might have PTSD. And then thinking about actually whether your child needs further support, it is worth considering a few questions. So how serious are these difficulties? How long do these experiences last for? So for example, if they maybe lose their temper and get really distressed, does it take 10 minutes to recover, or actually is it taking all day? And how frequently are they displaying these symptoms of PTSD? How much of an impact is it having on their life? How long have these difficulties been going on for? And broadly speaking, are things getting better, worse, or about the same? And I suppose really holding in mind the recovery paths that Jack talked about early on. Actually, where are we thinking that this child might fit? And after considering those questions, and if you are still concerned and you feel like your child needs professional support, we'd suggest contacting your GP, and who they may then refer your child onto a specialist service like CAMHS or like Yellow Door. But in the first instance, yeah, have a think about those questions and then seek advice from your GP if you feel like your child does need further support. We've included some links to some really brilliant resources. So the UK Trauma Council website is full of information for parents and young people on trauma and PTSD. It has some lovely videos on there about how the brain is affected in PTSD, and the videos have all been created with young people who have experienced PTSD, so they're excellent. We really recommend those. Beacon House is another website which has got a huge amount of resources, really, really lovely resources for parents who've experienced trauma, and some really lovely practical strategies, but also some information sheets about PTSD symptoms and what your child might be experiencing. And there's a website called CAMHS Resources, which has also got a whole bank of resources that you might find helpful. So thank you so much. I hope it's been helpful. We are going to have some questions and some comments now, so we'd really welcome anything.
I don't have any questions, but it was a very useful talk. Thank you.
Oh, thank you. Good. Well, thank you so much for being here.
It's all right.
Just to say that this QR code is a link to a form, so just a feedback form, so we can kind of work out how, like, is there anything that we've missed? Is there anything that people find particularly useful? So for future presentations, we can make it as good as possible. So if anyone wouldn't mind filling in the QR code, or kind of filling in the form from the QR code, we would be really, really grateful.
Thank you.
That's great. Jack, I did send you over a few questions, that sort of things that we
Yes.
hear from our group. I couldn't put them on the other form because I'm recording, but they are fairly sort of generic, I think. Is it all right if I ask them?
Yeah,
if
of
nobody else
course.
has any questions. Just we hear a lot about sort of young people within our group who have trauma from school, and can it be that, you know, children can have proper trauma from going to school? And if so, how do you, I know this is a big question, but how do you manage that when you still have to send your child to school if they're showing those symptoms of trauma?
It's really difficult. I suppose in terms of PTSD, what we often think about is something called big T trauma and little t trauma. So big T trauma are things like those things that Jack mentioned, like assaults, abuse, burglaries, fires, car crashes, things like that. Those kind of quite big, one-off, unusual events, which can trigger PTSD. We also, however, think about small T traumas, which are things kind of like these kind of everyday things, but actually that can be repeated and quite chronic, and actually they can still have a very significant impact on a young person. So certainly, you know, the kids that we work with, some of them absolutely do find school incredibly distressing. I suppose it would take a further assessment to think about, are they experiencing PTSD, or are they experiencing heightened anxiety and distress as a result of those experiences? So yeah, we wouldn't be able to say that unless we had a specific, you know, in-depth assessment. And in terms of what you do about that, hopefully some of the principles that we've talked about today might be helpful and relevant in terms of helping your child to feel safe and helping your child to feel calm and connected and hopeful and more in control. Actually, hopefully all of those principles are really relevant. And also, I suppose, thinking about that team around your child as well, and not trying to take all of that on by yourself. And also some of that making sense as well, you know, that the columns, the table that we talked about, actually trying to unpick and make sense of, why might my child be finding school really traumatic? What's going on? How can we best understand that? And then how can we find solutions to that?
That's great, thank you. Another question we get asked an awful lot is, when families are going for assessments for ADHD, sometimes they're told they can't have, you know, it's not appropriate to do the assessment initially because they need to explore whether or not the trauma has created something. And often that's quite hard to understand as a family. Sort of, they think they can see all the ADHD symptoms, but a professional can see more that it might be trauma impacting that. Can you explain a little bit about why that is?
About why
sometimes families who feel their young people are showing symptoms of ADHD are told when they may go on to CAMHS that actually they think it's trauma and that needs to be explored first.
Yeah, so there, if you think about one of those diagrams where there's 3 circles, and so one circle might be trauma, one circle might be ADHD, but actually there's a part in which they overlap. So the presentation of PTSD and the presentation of ADHD has some overlaps. So PTSD can cause people to find it very difficult to concentrate, can cause that kind of hyper alertness and that kind of feeling of being on edge, and memory difficulties as well, very common in PTSD. But there are also some really important differences, and the management and support for ADHD and PTSD is different. So actually it's really important that we get that right, and that we make sure that the help that is being offered to that child is the right kind of help. So that's sometimes why it's really tricky to understand what's going on.
Yeah,
and I appreciate that's also really hard for parents and carers.
Yeah, but that's really useful just to know actually about that overlap, and that's why I think that will, help a lot of people understand a bit more. Sorry, I've got another couple of very quick questions. One is sort of trauma more prevalent in people who are neurodiverse, or is it, I'm just wondering about some young people who really, are struggling with things and feel quite traumatized by experiences that other people may not, around sensory needs or that kind of thing. Is it more prevalent in people that are neurodiverse?
Do you know what? That's something that I would have to go away and have a look at the research around. So we do know that some aspects of neurodiversity, like learning disabilities, people with learning disabilities are more likely to experience traumatic events than people without learning disabilities. I would imagine that it's similar across maybe the autistic community, that actually they might be more likely to experience traumatic events. So I would imagine that, but I'd have to go away and have a look at the research to give you a really clear answer. I suppose what we often see in CAMHS, I suppose, is that kind of the small T traumas and the culmination of those across people with neurodiversity.
Just to add to what you're saying, Vicky, I think that the literature also supports that people with who are neurodivergent tend to be more likely to experience like anxiety and distress, and that can also, I suppose, kind of going back to the issues with school, because I imagine like if you do have sensory difficulties, of course school might be particularly more tricky, and it's that kind of anxiety and distress versus those little T traumas, which kind of make it really difficult to say conclusively. But I suppose if they're more likely to experience anxiety and distress, then I suppose that presentation can also just get really, really difficult to say whether it's, I suppose, likely to experience trauma or more likely to experience those kind of like things like anxiety.
Yeah, that's really helpful. And my final question, I guess, sort of as a follow-on from that is there a different way that you support people with neurodiversity in that sort of the therapy that they might have? So I know, sometimes we get feedback that sort of young people who are neurodiverse can struggle a little bit with the sort of DBT type therapies or CBT. Is there a different approach, or is it kind of the same approach but just tailored towards those young people's needs?
Yeah, good question. So the research and the evidence base indicates that actually the therapies that we have available to us are helpful for people who are neurodivergent, but that they do need adaptations. And yeah, obviously it's a responsibility that we have to make those adaptations and to make the therapy as accessible for those individuals with neurodivergence as possible. So yeah, it absolutely should be effective, and they should be able to get benefit from it. It like all our young people, all the therapy needs to be tailored and you know, individualized.
Yeah, no, that's brilliant. Thank you ever so much. I'm just going to stop
Okay.
recording now.